Hi, Assalamu alaikum everyone. My name is Dr. Sayyada. It's great to be here this evening on Muslim Mamas. We were meant to have Dr. Nasreen with us as well, but unfortunately, due to unforeseen circumstances, she hasn't been able to join us. So welcome to the live, everyone. Now, I know Muslim Mamas has been supporting the NHS, the new NHS campaign, the Help Us Help You campaign. And so today I just want to spend a little bit of time going through what this campaign is about, answering some of your sort of common questions. We will also have the live chat box as well, so you can feel free to sort of put any questions in there, and I'll try my best to either answer them at the end of the live or come back to answer them on Facebook later on. So the Help Us Help You campaign, it's a new NHS campaign by NHS England, and the main reason this campaign sort of came about was because the main sort of aim of it is to tell the public and about cancer symptoms, in particular 3 particular areas of cancer, so abdominal cancers, urological cancers and lung cancer. And the reason for doing this and telling the public about the symptoms and being aware of the symptoms and when to seek help and when to see your GP was because during COVID, what we saw was that a lot of there were less people that were coming in to see us with cancer symptoms, and there were less referrals for cancer. And it wasn't that just, during COVID, cancer suddenly disappeared. Unfortunately, what was happening is that a lot of the public weren't coming in to see us. A lot of the symptoms weren't being recognised, or, there were many patients that were scared of coming into the GP surgery because of the fear of catching COVID. And also they didn't want to be a burden on the NHS. So this whole sort of live is to just tell you a little bit more about the symptoms of these particular cancers, what you need to be looking out for, when you should seek help, and really sort of encouraging you and your loved ones to do that. So I'll sort of run through the campaign and answer those questions. So just before I go into that, I just want to highlight where you can find more information on this. So www.nhs.uk/conditions/cancer/symptoms. So if you go on that NHS website, you will see the different cancers and what sort of symptoms to look out for. So it's really, really important to be aware of this. So please sort of, share this video with loved ones as well, so that everyone's aware. So I've mentioned sort of the cancers that we'll be talking about. So the cancers that happen in the abdominal area, urological cancers and lung cancer. So just to break that down a little bit, the abdominal cancers, they include the esophagus, which is sort of our food pipe, the stomach, the pancreas, the bowel, uterine cancer, and ovarian cancer. And the urological cancers, they include the prostate, kidney and bladder. Now, there's the symptoms. I'll sort of go into details of what sort of symptoms to look out for, and there are sort of some kind of core symptoms that we need to be aware of. And so the reason that we're sort of focusing on these particular cancers and lung cancer is, like I said, we saw fewer referrals for these particular cancers sort of since March 2020. And so we just want to, and a lot of these sort of abdominal and urological cancers, they actually account for 44% of all cancers in England, and 41% of cancer deaths in England. So it's really, really important that we are able to recognise these symptoms and get the help that's needed, because the sooner these cancers are picked up and diagnosed, then the sooner that the treatment can start and your chances of survival. So just running into I'll go into symptoms in a second, but the reason just talking a little bit about the why we are targeting certain age groups. So this particular campaign is targeting the over 50s for the abdominal and the urological cancers, and the over 60s for the lung cancer. And that's mainly because we see these cancers occur more in those age groups. So we see 9 in 10 cases of the urological and abdominal cancers being diagnosed in the over 50s. So the risk basically increases as you get older, and with the lung cancer we see that 89% of cases are diagnosed in the over 60s. But again, that's not to say that you don't see these cancers in younger age groups. I was doing a live yesterday where there was, sadly there was a lady who was diagnosed when she was at the age of 49. So just be aware that anyone can be affected by these cancers, but it's more these age groups that we are targeting. So looking at the symptoms that you should be aware of. So again, these symptoms can seem really broad, and there are a couple of specific ones that I'll mention. And now it doesn't mean that if you have any of these symptoms, you've got cancer. It's more to to say, you really need to be seeing your GP if these symptoms are persisting, so that you can be examined and you can have investigations to rule out anything serious going on. So for the abdominal and the urological cancers, the main symptoms to be aware, so for the abdominal ones, the main symptoms to be aware of is any diarrhea or any tummy discomfort, which is persisting for 3 weeks or more. There might also be other signs or the symptoms like feeling bloated. There might be constipation, so basically any changes in your bowel habit. You might be feeling sick, so nausea, you might be vomiting, or if you see any blood in your stool. So those are really things to be aware of. So any changes in your bowel habit, any tummy discomfort for 3 weeks or more. And with the urological cancer, so that's your kidney, your bladder cancer and prostate cancer in males, you're looking for any blood in your urine. So even if there's just one episode of blood in your urine, again, you really should be speaking to your GP about this. And even if so there's other again, these might seem a little bit broad, but if there's any you might experience any unexplained weight loss, if there's any lumps that you feel in the tummy area. For females, if there's any unexplained vaginal bleeding, or if there's any bleeding after the menopause. So very, very important to be aware of these symptoms. So any of these, please make sure you're going to see your GP. Now for the lung cancer, if you've had a cough for 3 weeks or more, and it's not COVID, then again, it's really important to speak to your GP about that. Other signs of or symptoms of lung cancer, so if you've had recurring chest infections, so chest infections that keep coming back, if you're coughing up any blood, and if you've got a long-standing cough that's just getting worse, any pains when you're breathing, any persistent breathlessness, so you're feeling very short of breath, if you're feeling very lethargic, very tired, and again, any unexplained weight loss, any lethargy, loss of appetite, any of those symptoms. So it's really, really important that you, to be aware of these symptoms, not to be embarrassed about any of them. So I know when we're talking about the blood in your stool or blood in the urine, I think especially in our community, we get very embarrassed to talk about these things, and it's really, really important to normalize it, to have these conversations with your elderly relatives, with friends, with family. Just normalize these discussions, talk about how they're feeling, how have they been, have they had any particular symptoms, or they feel unwell at all, because I'll come to this a little bit later, but it's really, really important that if there is anything, then it's picked up. The earlier it's picked up, the better. So just sort of talking a little bit about why it's important. So, you know, why is it so important for people to contact their GP if they notice any of these symptoms? So, you know, I've said before that if you do have any of these, it doesn't mean necessarily that you have got cancer, but these can be signs that there may be cancer. And there's no sort of, you know, don't be worried about, you know, burdening your GP, about burdening the NHS. This is exactly what we are here for. We want to see you if you experience any of these. And the main thing also to be aware of is that cancers are much more likely to be treated successfully if they are caught at an early stage. So, for example, in the case of bowel cancer, 9 in 10 bowel cancer patients, they will survive for more than 5 years if it's diagnosed at an earlier stage. And very similarly with ovarian cancer, 92%, you know, if they're diagnosed in the earlier stages, will survive at least sort of 5 years, compared to sort of 13% if it's diagnosed in a more advanced stage. So this is why it's really important for the public to be aware of these symptoms that could be a sign of cancer. So those are sort of, I'm just going to make sure that there's no other sort of key messages I've got, so bear with me. I just want to make sure that I've got all of the different points across here. Oh yeah, so a lot of the times we've been sort of asked, you know, you've got these campaigns that are running that are encouraging the public to go and see their GP, but sort of in reality, it's really, really hard to get an appointment with your GP. We can't get through to them on the phone, or we're waiting in the queue for a very long time. What can we do about this? And you know, this is completely understandable. So, you know, that there has been that sort of, we can understand the pressure that's been on the health system. But we really want to sort of get the message across that general practice is, it's remains sort of fully open. It's safe to go to your GP. You know, you don't need to be worried about catching COVID. There's safe sort of protocols in place. You don't need to be worried about overburdening us. And in terms of contacting your GP, so if you're not able to get through to them on the phone, there are different ways of contacting them. So usually most GP surgeries will also have a website. And they are now all pretty much doing this sort of e-consult form online as well. So you can go online, you can type in sort of there'll be a form on there that you can fill out with your symptoms, and sort of what the issue is, and the GP will get back to you. Usually it's within sort of a couple of days. And obviously you can put on there that what your concerns are. So there are sort of different ways of trying to contact your GP. And obviously if it's anything really urgent or anything that you're very concerned about, then please, you know, make sure you're going into A&E for that. Okay, there was also a question about the symptoms that I've mentioned sort of for the abdominal cancers. You know, a lot of these symptoms you can get in other diseases as well, or, you know, for example, the blood in the stool, you might get that if you've got hemorrhoids, piles. So how do you know sort of if it's hemorrhoids or piles, or if it's something like cancer? And this is exactly what this campaign is about. So if you do have blood in your stool, it's difficult to know what it's due to. It's not always obvious if it is due to piles or if it's due to cancer. And that's why it's important to see your GP so that they can take sort of a full history, we can examine you, and if need be, we can also refer you on for investigation. So if, you know, for some blood tests, or whether it's scans, and that's the sort of more kind of conclusive way to know what's going on. So I hope sort of that answers that question there. I just want to check whether there's anything else here. Bear with me. There was also a question about sort of our elder members in the community. They tend not to go and see the GP. They're scared that they might be disturbing the GP, or they might be thinking that their symptoms are not serious, putting them down to sort of, you know, other things. So, what advice is there in terms of speaking to our elders and reassuring them that they should be seeking the advice if they have any of these symptoms? So I think this, I think our elders in our community, they do so much for us. They want to really protect us, and in sort of scenarios like this, when they've got some sort of illness or they're not feeling well, they might sort of brush it under the carpet, or sort of not mention exactly what's going on. And that's why I think it's really, really important to normalise these discussions with our elders, to tell them the importance of getting the help early on. Obviously, we want the elders want to be there for us. They want to look after us, and we want them to be there. We want them to be there as long as they can. And so it's really, really important that they get the treatment early on, and that they understand sort of the importance of that, because if they are diagnosed earlier, if anything is picked up, then the treatment for the cancer is more likely to be successful. I also think just, normalizing these discussions in terms of not being embarrassed about talking about, poos and stools and urine and blood in the poo or blood in the urine, or sort of, bleeding after the menopause or vaginal bleeding. It's really, really important that we have these open discussions with our elders in particular. And I think also when they hear the term cancer, that can also cause a lot of panic as well. They sort of quickly sort of put it together with dying and things like that. So again, just sort of explaining to them that these are the things that's really important to be aware of, and that treatment is available if these cancers are picked up early, and there are good chances of survival, of being sort of cured from these cancers as well. So I think we just need to have those discussions more with our elders. There was a question about recognising a cough from COVID. So again, if you've got a persistent cough, it's really important to do a COVID test. If you do the COVID test and it's negative and you've had the cough persisting for more than 3 weeks, then again, important to see your GP, because they will then do more tests. They will examine you, they will listen to your chest, they will then most likely send you off also for a chest x-ray to see if there's anything going on. So I think that answers most of the sort of questions on the campaign itself. Let me just have a look to see whether we've got anything. Bear with me. Yeah, so I'm going to just see whether we've got any questions on the Facebook Live itself. If not, I'll sort of summarise, and I really hope that this has, I know it's been quite short, but I hope it's been helpful to know sort of the main cancers to be aware of, the main symptoms to be aware of, and when you should be seeking help and seeing your GP. Yeah, okay. So I don't think there's any questions at the moment, but if there is anything, after you've seen this video, if there's anything that comes to mind, any concerns you have, or just any other questions you might want to ask, please feel absolutely free just to write it in the chat box on, under the video in Facebook, and I will answer those questions on there in the comment section. So just sort of wrapping up on the campaign itself and the sort of takeaway message that we want to sort of make sure that people are aware of, is that if you've had any sort of tummy problems or any discomfort in your tummy or any diarrhea for 3 weeks or more, that could be a symptom or sign of abdominal cancer, so please see your GP. For urological cancer, if you've noticed any blood in your urine, even if that's just the one episode, again, please go and see your GP. And for lung cancer, if you've noticed a cough for more than 3 weeks, Also, the other things I mentioned as well, so if you're, any changes in the bowel habit in general, any unexplained weight loss, any lethargy, feeling very, very tired, those are things to look out for. Your GP practice is open. We're seeing patients as we did before, face to face. There's no sort of, I know before during the pandemic, some of this went to telephone calls or video calls. So we are, as we were before, seeing patients face to face. So please contact your GP. So you can call them. Like I said, you can go on the website. There's usually an e-consult form that you can fill out as well to try and get hold of your GP. So please don't sort of, have any delays in being seen, and make sure that you're encouraging your loved ones as well. So if they have any of these symptoms, please encourage them to see their GP as well. And just remember that the sooner these symptoms are picked up, the sooner you can be diagnosed and start treatment, which is more likely to be successful. So I really hope that helps. And like I say, if there's any questions that you have, feel free to put them in the Facebook group and I'll answer in the comments. Thank you so much for listening. I know it's been a bit of a quick whiz through all of that, and I hope it hasn't been sort of an overload of information. But maybe, if there's anything, then don't hesitate to ask. Thank you so much for listening.